having said that, I want to welcome Rebecca Clark and Jennifer Boniol from Lewisville ISD in Texas.
Thanks so much. All right, so I just wanted to share with everybody just kind of some backstory of where we're coming from. Like everybody else who's battling truancy, we all know that when the law changed, it really created a difficult environment and for us to have any sort of effective use of the court system, and really started to limit our tools in holding students and parents accountable for coming to school. And I made it a personal mission starting a couple of years ago to see how I could turn the culture around for us, because once our administrators felt like they had lost their tools, they didn't see the value in expending energy and resources chasing truancy when they couldn't find success with the outcomes. And so we went through a period of time where it was kind of one of those issues that we knew was out there, but we were ignoring, doing just a little bit of lip service to. And I felt like we needed to turn that around. And one of the things that we needed to turn it around was a better data solution, which led us to RaaWee. And last year was our first year to use the RaaWee software. And while it was life-changing in terms of how we could now access what we were doing, it was also overwhelming. One of the biggest responses, I mean, when I saw the program, I'm like, oh, this is amazing. I was so excited to dig in it, to work with it, to start to have my hands on good data. And when I rolled it out to the campuses were completely and totally overwhelmed. I don't know what to do with this. There's so many things on my board. And so we had to have a pause and a conversation about that. All these problems, all this truancy, all these student needs were already there. All the software did was help us understand and see every day that those were there. And so we spent a lot of last year trying to struggle through just recognizing that we had probably ignored this problem for far too long, and we needed to take some other steps. And so last year I was truly a department of one. And so I was trying to do my whole job in student services along with reset our culture around attendance. And this year I was able to hire Jen, which has been amazing because now she can be that point person focusing on this. And one of the things that we've learned as we've tried to change our culture around truancy is that there is a tendency to have a checklist mindset. That the idea is, what do I have to do to get to court? And I will tell you that we're fortunate enough that we have a judge who works with us, who is willing to partner with us to the extent the law allows him to, is by all means invested in our students. So we're really fortunate in that we actually have started taking kids to court, but we have to change our campus culture around the idea that it's a checklist approach. Did I send the warning letter? Did I do the attendance plan? Did I meet the timeline? Let's go to court. And that our focus has to be more on the middle. What do the interventions look like that are beyond the checklist? Okay, next. So one of the questions I would ask each of you that's here today is, when you reflect on what you do to intervene with truancy, do you find that your interventions are focused on compliance, that checklist approach, or do you find that they're more focused on student need, or do you have a healthy blend? Because I actually feel like that there is a nice balance. We need to do the compliance pieces, which have value, but we also have to do the student need piece, which I know some of you are probably thinking, how do I focus on student need when I have so many students? We're a district of 50,000 kids, and we feel that. We know that the struggle is real for our campus administrators to think about kids individually with truancy intervention. Next. So when I talk about compliance versus need, here's kind of a big picture thought about that. Again, the compliance is that warning letter, trying to have a meeting, putting an attendance plan in place, and doing the truancy filing if we get to that point. Where on the flip side, the needs of the students should be centered around building relationships, improving relationships, building skills and capacity for the student if they're lacking, providing that scaffold and increased level of support where their need is, identifying what the needs are, utilizing our counseling resources and our community resources. And so we think those things are equally important as we move through working with students experiencing truancy. All right, next. I did link a few resources at the end of our presentation that kind of talk about this, and I know that this is not anything that's the least bit surprising to you. I know when I throw this data out here, every one of you are probably going, yep, I don't even need research to tell me that this is true. But we all know that when it comes to mental health conditions, depression, ADHD, trauma, all these things, that they are closely correlated with chronic absenteeism, truancy, and just outright refusal. We've had quite a few cases last year and already this year where the parent says to us, I cannot get my child to school. I cannot get them in the car. I cannot get them out the door. I cannot get them out of bed. And we know that this mental health piece cannot be ignored because we can't physically force the child into the car, onto the bus, into the school door, at least not long term. That can't be our solution. So we have to look at these mental health conditions that may be contributing to the kids not coming to school. All right, next. So one of the things I want to talk with you guys about today is a program that we have that focuses on small group counseling and skill building for both our students and our parents. We've named this program ADAPT. Next. And ADAPT is locally developed. It involves both the parent and the student. The program is 3 consecutive sessions. They do it once a week after school for 3 weeks. We actually use this alternative quite a bit with discipline as well. Our students can actually earn days off of a DAP placement, or sometimes even do this program in lieu of like ISS or OSS. But we also originally developed it as a truancy intervention, and we're working to try to really expand our use of it. The program is facilitated by district counselors. We do pay them an extra stipend per session to facilitate this. If they agree to participate, the parent signs a contract. They say they'll come to all 3 sessions. And then we actually have let our judge know that we would be able to support it if he court orders participation. So we use this program as an intervention before we ever go to court, but we can't force parents to come to this. And so sometimes we offer it, recommend it, even require it in an attendance plan, and they won't participate. So we have let our judge know that if he chooses to court order it, we will provide the resources, to allow them to attend. Next. So the structure of ADAPT is that the kid and the parent come together. Sometimes they come with both parents, but we do require that at least one attends. And really key here, the focus is on skill building for both parties, both the student and the parent. The format of ADAPT is heavily focused on a reflective discussion, which I'm going to show you about a little bit, and then validation of the strengths that the parties are able to identify that they already have, and exploring areas of growth. So they start out, they have a couple minutes together, and then they break into groups. So there's a parent group with one counselor and a student group with a separate counselor. And they go through the bulk of the program in those separate groups. Then they come back together for some whole group reflection and closure, where they look at key takeaways really focused on student needs and how the parent can support those needs, and then how the parent and child can keep that conversation going and keep those skills growing after the session ends. We do offer this we offer sessions available at all 5 of our comprehensive high schools. So we've tried to make it geographically convenient for our families to participate in the program. And again, it's after school hours, 1 day a week for 3 weeks.
And a lot of things that just starting with truancy this year, having RaaWee with each campus having their data in front of them, a lot of the parents, when we're reaching out to the families, they're reaching out to us for help and support. And we're having more and more of that this year, is the families needing this help. So we've had tons of parents sign up for this, and they're looking for a way just to build that relationship with their child also. And also, how do we get them back to school? Because post-COVID and pre-COVID, we're in two different eras right now with our students. And, you know, most of the truancy that we've been dealing with is the homelessness, the students reaching out for resources. So us partnering with our counseling on campuses and on the district level has been huge for us to start this school year.
When we go to court, and we actually do take families to court, probably our most common theme centers around anxiety, depression, mental health, and not being able to function at school. So this is an important first resource, I think, to offer. Next. So I wanted to give you all a little bit of a snapshot around the curriculum in this. So week 1 is about self-awareness and self-management. And so I put a sampling there of the questions that they talk about in the group discussions. They're a little bit different in this one for the parent and the student. So they focus on talking about why are you at ADAPT? Are there other struggles that you have in your life right now? And with the kids, they try to get them to connect with their parents by thinking, do your parents have similar struggles? Our kids and our parents both often feel like they're in it alone. They don't recognize that other people are struggling like they are. And even parents and students don't always connect that they're both facing some of the same things. They have the students reflect a little bit on how they feel their parents react to them, or support or don't support them, and also a little bit on the impact of their behaviors and their choices on people around them, that awareness of impact beyond themselves. And on the parent side of this, they try to help the parents kind of put themselves in their kids' shoes a little bit, remembering some of the struggles they had when they were that age and how their parents may or may not have supported them, and even reflecting on how things are different for kids today than they would have been when the parent was growing up. Okay, next. Week 2 is talks about social awareness and relationships. And again, this is just a sampling of some of the discussion questions that they're having. In this week, the parent and the student questions are very similar. So they actually are talking about the same things, just in separate groups. And there's a focus on kind of really trying to understand what communication is like for each person, both verbal and nonverbal, struggles that people have with communication, and how they know if they're effective. How do they know people are hearing them, listening to them, responding to them? And then from the student perspective, what are the challenges that they feel like they face when they're communicating with adults? And on the parent side, what are the challenges that they feel like they face when they're communicating with their kids, with teenagers, or even younger kids? We talk a good bit about technology and how technology influences our communication styles, our skills, because we do see that that is a very important and often negative aspect of communication, and it often influences relationships in a way that isn't positive. But there are opportunities there as well. So we have them talk about that, and then about what their communication style is, and then a key thing is about really reflecting on what type of communication makes each person feel connected, valued, appreciated, heard, understood. And then in the area where they talk about the validation of strengths, they get the participants to really reflect on what about your communication style and strategies works well for you right now, and then what are the ones that you see as challenges that you could work on. All right, next. All right, and then the last week, week 3, is about decision making. And they are looking at pretty similar questions between the parent group and the student group, kind of focusing on strategies that people use to make decisions, what it looks like to make an informed decision, and what kind of information you would want. the impact that emotions have on our decision making, and really a little bit of mindfulness and reflection on have you noticed that when you're experiencing certain emotions or situations that can possibly trigger decision making that isn't in your best interest. And then even like looking at when I'm experiencing emotions or going through certain things, what do I notice about myself? Do I become more unreasonable, irrational? Do I lack judgment? We're focusing on some real specific situations, and then kind of wrapping up with some teaching about coping skills. So the counselors actually go through and share examples of healthy versus unhealthy coping skills, and then some techniques around some specific strategies. I mentioned some of the ones, but they actually give them examples and work through some of them together to try to empower both parents and students in not letting those emotions impact their decision making in a negative way. And again, kind of just talking about that the core work here in ADAPT is discussion, and that they continuously try to keep all participants engaged and active in the discussions, but it's not going to be a forced situation. You're not penalized if you're there and you're reluctant to speak. And the counselors, this is truly from a counseling mindset that they really want participants to participate to the level that they feel comfortable sharing. And so that can look different, from group to group. They might actually have a session where it turns into one-on-one because only one parent and student show up. And those can be interesting. You might have a session where it's a larger group. From a scheduling perspective, they try to keep the groups reasonably small so that everybody has an opportunity to participate, and it's not so large that doesn't exist. And so if we only normally have one session scheduled a week, but they find that the participation level's up, they can add additional sessions to include more people.
And the positive thing about ADAPT is, as administration, you start looking into your truancy cases. Every case is different. The reason behind it is different. The why behind it is different. And this program allows all the different cases to come together and to be able to be productive. And also they have additional resources that are offered afterwards if family continues to need counseling, if CIS needs to be involved. So it really is a good avenue for parents to seek for any type of help or resource that they need.
All right, next. All right, so this was a resource that is in the group setting, but I want to talk with you a little bit about some individualized resources and supports that we have added that we utilize in truancy intervention. Next, please. All right, so one of the things that we did is in the RaaWee system, we, I know some people here use RaaWee, I'm not sure if everyone uses it, but you build in the interventions that are triggered based on a certain number of absences unexcused. So we actually built a counseling referral in as one of our interventions when students get to the 6th unexcused absence. But what we know is it's not appropriate for every student to be referred to the counselor when they hit that absence. Last year we actually had 2,900 students who legally would have been considered truant. It's a huge number. Our counseling staff would not be able to see all those kids. And I actually put that in that little red circle there. Please, you have to be careful about overburdening your counseling staff. They cannot see every kid experiencing truancy. And so that means that we need to have a little bit of triage as we move into this. So what we've told our attendance staff and our administrators who are working through truancy at the counseling level is there's a series of questions that you can ask yourself that might say, yes, it is appropriate to go ahead and go through with this recommended referral. The most obvious one is, do I know that the student has mental health concerns? Am I aware that there's trauma in their background? And that is definitely going to make it appropriate for counseling. Also, have I identified that the student has some ineffective coping strategies? They lack this skill. That might also be a counseling referral. Is there homelessness? Does the family dynamic show some dysfunction based on conversations I'm having with the student and the parent, history I perhaps know about the family? Do I know that the family or the student may or is experiencing some pretty significant situational stressors, so something that's happening in the moment? Is the student or parent unwilling to open up? When you're having these conversations, are you not able to get any good explanation about why the student's failing to come to school? Does the family seem closed off, secretive? The student won't talk to you. This is a great opportunity for a counseling referral. And then I often tell our administrators, have you tried to build this relationship and just been unsuccessful? If administrators or teachers or mentors or other people haven't had any success in building that relationship, it might be a good opportunity for the counselor to try. How do you think that?
You know, this is a good checklist just for your admin to have access to when they're going through this. So, you know, RaaWee does provide the opportunity to have the checklist, and it's been extremely helpful for our admin to, when they get to this intervention, just to go through this list, and also when they speak with the parents.
Okay, so next. So we obviously have some tiered supports that we can offer, and these tiered supports do start with the campus counselor. Every one of our campuses has a counselor. At the middle school and high school level, we have multiple counselors. The elementaries usually only have one. But one of the layers that we added is something that we call student assistance counselors. And I'm going to talk about a little bit more on that in the next slide, but that is a smaller number available. We also have social workers that can be leveraged. And then we have 2 levels of counseling support. The ADAPT that I talked about, which is your group counseling sessions. I'm just going to add this in just as an FYI. You'll notice I also put HOPE, because we took our ADAPT framework and we tweaked it to specifically, if I can talk, support drug and substance abuse and use. And so for our students that we know are experiencing that, they can actually go and do the HOPE program, where the questioning and the discussion and the activities are more centered around knowing that students are experiencing those substance abuse problems. Not every situation is appropriate for a group counseling scenario. So the last thing I wanted to mention that we do offer is what we call Choices Family Counseling. And this is actually a little bit more therapeutic. This does offer the family, parent, and students to go together for up to 6 counseling sessions that are very focused on that individual family dynamic. And then the Choices program will hook them up with community resources if they need counseling beyond 6 sessions. Next. So let me talk a little bit about our student assistance counselors. We added this position a few years ago because we recognized the growing need for a little bit more specialized mental health support. This is not therapeutic. You know, our school setting is not therapeutic, but it certainly is an opportunity for counseling with greater frequency and intensity than the campus counselor normally is able to provide. We focus on students who have either chronic mental health conditions or they're in kind of an acute mental health crisis at the moment. Students can only access this support through a referral from a campus administrator or a campus counselor. We have 1 of these positions per comprehensive high school, and then 6 additional positions that are shared by our 54 K through 8 campuses. Could we use more? Absolutely. So we continue to grow this support. So this is something that we leverage in truancy intervention when the counseling referral piece comes up. Sometimes students can just work a little bit with their campus counselor and get that support. But when administrators or campus counselors recognize that this student is going to need a more intense level and ongoing support, they can refer them to this position for assistance. Okay, next one. All right, so that takes us to the end of kind of talking about those layers of both group and individual support that we're trying to leverage when we recognize that mental health is or may be a factor in the student not coming to school. And that is all that we have in our presentation, and we are open if anyone has questions.
Thank you so much. Anybody who has any questions, put it in the question box.
And one of the things I want to add while you're waiting, Janie, to see if anyone puts questions in there is that we try to be very intentional and clear with our campuses that counseling staff is not responsible for managing truancy intervention. Mm-hmm. That is an administrative responsibility, but what we're encouraging is the partnership between administrators and the resources that our counseling professionals and mental health professionals can provide. And so we think it's very important that this responsibility doesn't just get dumped on a counselor, but that there's true partnership and trying to decide what the best resource is for a student. You know, some of our students are served by special education, and they also have counseling resources. And so sometimes we go down that special education counseling path if that's more appropriate.
Perfect. Okay, we do have a question coming in. What role do your social workers have in the intervention system you outlined?
So our social workers are typically accessed through the counselors. So the front line of intervention is administrators and campus counselors. And from there, they disseminate to these other layers, including the social workers, where they think that the support might be needed. So when they find out that a family is experiencing homelessness, a lack of resources, perhaps the family, you know, not just day-to-day living resources, but sometimes we find that our students are in need of intervention beyond what the school can provide, whether that's outpatient, inpatient, or some of the other things through our MHMR. And so the social workers can help connect the families to those resources that they may not be aware of, or they don't have the financial means to independently access. They also will, in working with the family, connect them to those other basic life resources. So if they find out that a family is not coming to school because of transportation, how can we help them access that transportation or secure district transportation? If there is food issues, if there's medical care issues, if the parent needs support. One of the things that we're finding is that the mental health issues that cause our students to experience truancy sometimes are the parents' issues. Mm-hmm. So they can help the parents access that mental health support for themselves within the community. So those would be some key areas.
Excellent. Any other questions? Okay, very thorough, great information.
Email is the best way to get either one of us, and we're happy to share more information about these programs to anyone who's interested.
Wonderful, and I will include that as I distribute your presentation. Thank you very much